So we're going to demonstrate the use of a Ziplyft device using chicken skin as a demonstration of how the device works. The device will come in a white box like this. Inside the box will be a sterile peel pack that has the Ziplyft device. It's a double sealed pack, and inside it you'll have a sterilized set of devices. The white device, the device with the white blade handle on there, will be the right, and the left will be the black blade handle. And you also get green forceps that come with it as well. Once you have the peel pack, you're also going to have a peel pack that's sterile of the Dermabond. So we'll get that out as well. And a sterile marker and pen like you use for standard blepharoplasty. So what I usually do is get 2 chicken thighs. It seems to be the best option for this. And when I mark the patient, I actually mark the patient centrally, right above their nose. And then I mark 40 centimeters to the right and 40 centimeters to the left. So we have a nice marking for symmetry for the devices because they have markings over the top. So we're just going to go ahead and put our skin marker down. And we will basically the center of the patient's face, which is where his nose is going to be. The patient is facing this way. But we're going to put that at 40, and then we'll just mark it here at 0 and 80. So this is going to be left, and this is going to be right. Okay. And then to do the skin markings, we usually want to do 40 millimeters. We're going to do like the lower skin markings at 40 millimeters on each side. And I usually go up about 12 millimeters up for the cut. So I'm just going to mark that along there. Markers. There's another type of marker, I would take that too. And then I have my 40, so 40 here. There. Okay, and then we're going to do the other side where we do the 40. Thank you. So then you've got your ellipse of tissue that you want to remove, right and left. Make this a little bit darker. Pens and chicken skin are not always cooperative. So then usually we have you take the green forceps, and we'll really want some feedback on what you think of the green forceps and how wide you think the base of the green forceps should be. But it just helps to pick up the skin and kind of create a little crease there for the chicken skin dissection. And then the right device, there'll be when we have a finalized device, it'll be temporal for each side, but you want to confirm that for the right eye, it is temporal, and you can see there's only one side of the blade that's sharp. So make sure you're using it properly. If you use it over here and try to cut, it's not going to cut. So you want to make sure that it is temporally for the right. You can go through and grab the tissue with the forceps to pull it in. You want to make sure you have all the purple marked tissue in there, and it's on this side of the jaws. So I'm just going to go ahead and put that in place, and we'll lock it into place. And then the left one, the blade is again temporally, and we're going to grab that tissue and place it in there. Make sure we have all the purple marked tissue in there and lock it shut. They click shut. We're currently leaving it on for 2 minutes. I'm hoping that with clamping pressures increase, we'll be able to leave it on a shorter period of time, like 1 minute. But that stays in place. That's causing the zipper lock seal, as well as cutting off the blood supply. And then after it's been in place for a full minute, we're going to do the cutting, which the blade, we're going to pull the blade across. With this particular blade, it's good to push down on it, and as you're pushing it forward, and then you remove the excess tissue. If there's a little tag, usually the blade's not all the way over. You want to make sure it is, but then the sharp part is right there, so you can usually get the last of it off. And on the left one, again, you're going to slide the blade over, all the way over, and then pull that excess tissue off, preferably without a tag. And then after it's been in place for a minute, when you release it, You want the Ziplyft device to stay sealed. This one's a tiny bit open in the middle, and then this other one we're going to release. And the Ziplyft is sealed a little bit nicer on this side. In the human, it's usually just a little more of a ridge, a little higher ridge and upright. With the Dermabond, as you guys know, because a lot of you have used this, you want to break it open. You don't want to go on the patient immediately. You want to try it out on the drape first. Just do a little bit of it on the drape so you know it's not a big blob. And then you're going to go ahead and apply it to the incision from one tip to the other. Usually one coat is enough. If you were to have a little bit of bleeding, I do a little extra in the bleeding. It seems to help the bleeding stop a bit. When we're doing it with patients, we usually hold a Q-tip nasally right here so that the glue doesn't go into the eye. We haven't really had that problem, but the assistant usually holds nasally next to it so that the glue doesn't go into the eye. And if it does blob somewhere, you can, early on, you can wipe a little bit of away if you need to, but otherwise in a minute, it should be completely dry. And then I usually ask my patients to open and close their eyes, raise their eyebrows so that they have it all intact. So that's what we do for a chicken skin dissection, and we'll go from there. Thanks, Tom.